At the validation program, the focus was to discuss the problem and to find ways to improve families' and children's access to quality education, health, livelihoods, and social justice in the Diocese of Navrongo-Bolgatanga. The stakeholders were drawn from the Catholic Health Services, the Catholic Education Directorate, Catholic Schools, and the School Management Committee and the Community Health Committee all over the diocese. The Human Development Coordinator of the Navrongo-Bolgatanga Diocese, Mr. Joseph Ayimbela, told GBC News that findings at the program showed that over 80% of schools in the Upper East and Northeast regions do not have access to enough classroom space, furniture and textbooks that will improve children's learning. He called on the government to support in these areas.
A key issue that came up, and we're calling on governments about the textbooks. Children go to school, they have no textbooks to learn. Teachers are given only the guide, and that's from the guide to extract. And most of the teachers even find it difficult to interpret the guide. So we think this hampers the learning of our children in the schools, and government must act quickly to release the textbooks for all the schools, both primary and the junior high schools.
The primary health care coordinator for Navrongo-Bolgatanga, who led the team to conduct the baseline survey, Mr. Peter Ayamba Akudugu, complained about the inability of health facilities to have access to health insurance claims. He said the various health facilities had less than 3 months reimbursement claims for the year 2021. This, he said, was a major barrier to proper health care delivery in the diocese.
Almost all the facilities had less than 3 months of payment. In fact, the health committees didn't know of this because they have realized that any time they go to the facilities, they were not getting some of the drugs they needed, or they will write prescriptions for them to go somewhere and buy. And that is a worrying situation for most of the facilities.
Participants gave unsatisfactory reports regarding infrastructure and capitation grants for schools and equipment for the health facilities. They appealed to the government to support the church in its quest to deliver quality health and education for the benefit of the poor in society and to give support to the government's agenda.